I think it's very important to understand that as a result of exposure in the media, internet, newspapers, so forth about deep brain stimulation, that some patients arrive at the doorstep of the neurologist with expectations that have already been shaped that may not really reflect the true reality. A lot of people know but don't recognize that deep brain stimulation is not a cure for any of these diseases. It's an alleviation of symptoms. A very successful one, but however much people say that they understand that, sometimes at a deep level I think they wish, and this is just human, that deep brain stimulation would remove the problem from their life, which is never the case. Having said that, it can make some astonishing improvements in people's quality of life, in their function, in their reliance on medication. I think that very careful mental and psychological preparation of the patient is important. They need to have some time to consider what's involved in surgery, how their life might change. Often it might change in more subtle and complex ways that they don't fully predict. So very good discussion with the neurologist, experienced neurologist in the area, good discussion with the pre-operative evaluating psychiatrist and neuropsychologist is important. Of course, the surgeon. Once the surgery is finished, there is a period, as I mentioned before, of stimulator adjustment, medication adjustment, and this can go on for quite a long time. It's probably only about 3 to 6 months after which a patient's condition plateaus after the surgery. Sometimes, in fact, especially in Parkinson's disease surgery, there's a very prompt improvement which leads to a tremendous sense of well-being in patients. This might be only short-lived for about a week or two, and then there is a kind of a lapsing back, and at this point some patients become very despondent. They think the surgery hasn't been effective. But really what is happening there is some of the swelling around the brain electrodes is settling, and then the stimulator needs a little bit more adjustment, the medications may need some more adjustment, and it's a process. Then they will improve again with those adjustments. Things will go on for the next few months. And over time, the true effect of the surgery will become apparent, usually about 3 to 6 months after the operation.